I'm here today with Dr. Barbara LeBlanc of Guelph, and she's taking time out of her schedule to meet with me. She is a doctor that volunteers with Doctors Without Borders, and I'm going to be here asking her some questions today. So my first question would be, what do you generally do on one of your trips?
When I'm working with Doctors Without Borders, or MSF, I'm always working as a surgeon. Their projects are generally emergency projects, so I'm usually doing various types of emergency surgery. So some of that is trauma, like violence, gunshot injuries, but some of it's road traffic accidents, and then some of it would be infections or other kinds of emergencies.
And now, what is your favorite part?
Work-wise, my favorite part is probably when either the trauma or doing cesarean sections. So though we don't think of giving birth maybe as part of emergencies, when babies come you can't wait. So they're a part of a lot of projects. My favorite thing overall is probably the chance to meet people in a different country, both the country that I'm working in, but also the people who work on the project are from a lot of different countries. So it's enjoyable to have a chance to see what other people's lives are like in their home country and just talk to them about life in general.
Nice. And now, is there a least favorite part?
It's sometimes frustrating that we don't have the resources there that we do at home. So you'll see people or problems that you would like to do something further, either an investigation or a treatment, and you don't have that. It's not available on your project and probably isn't even available in the country, and that can be frustrating.
Now, is there a story that you have that just everyone loves, like the most exciting thing that's ever happened to you?
A woman had come in who had twins, and she delivered a twin at home, and the other twin wouldn't come out, and they had to travel, I think it was 16 or 18 hours since the first baby had been born to get to where we were working. And the midwife couldn't hear a fetal heart rate, so they thought the baby had died. And so when we operated, the baby was stuck in such a way that she still needed to have a cesarean section, but we thought the baby was dead. And when we operated, to our pleasure and surprise, the baby was still alive and the baby survived.
How have these trips benefited you?
You're working in places where you're likely the only surgeon, so you're also the orthopedic surgeon, the neurosurgeon, the obstetrician. So it's been a challenge to learn new skills, or skills that I haven't used in a long time, to perform cases that I wouldn't do at home. On a personal level, it certainly made me appreciative of how much we have in Canada. And you certainly see in these countries that you can be happy with very little, and that money goes a long way in other countries. And Canada and individuals, we spend so much on foolish things that make a huge difference in a lot of the developing countries.
Where do you do most of your volunteering?
I've usually worked with MSF France, and MSF France usually has about 8 or 10 surgical projects going on around the world at any one time, and probably 2/3 of those are in Africa. I've been in Congo, Chad, Central African Republic, Nigeria, Uganda, although that was not with MSF, Cote d'Ivoire, and most recently Pakistan.
When you went to Pakistan, how is that different from Africa?
Pakistan is a much richer country than most of the African countries I've been in. And the area I was working was on the Afghan border, and the reason MSF was there was because of the violence. They had attacks and bombings and suicide bombers, and so they couldn't get Pakistani doctors to work in the area. And the other thing was quite different is Pakistan is a Muslim country, and the area I was in was very traditional, so I had to wear traditional Muslim clothing, including head coverings and face coverings.
When Doctors Without Borders is choosing where you are going, how much do they consider political stability?
Most of the places they're working in would be considered somewhat politically unstable, because they're either very poor or unstable, or they wouldn't sort of need their help. But they make sure that it's safe for us to be there. So if they feel it's unsafe, they won't send us. And they're very serious about security. And for example, when I was in Pakistan, we weren't allowed to leave the hospital. So for the 5 weeks that I was there, I had to stay within the hospital compound the entire time. What they try to do is see is it safe for us to operate at all, and then make security rules to make sure that we stay safe once we're there.
Have you ever gotten any backlash for your work at all? Are there any stereotypes about Doctors Without Borders?
In the countries we work in, the people often don't quite understand who we are at first. So the initial parts of projects are always telling the population about why you're there. And part of their philosophy is that they treat people regardless of race, religion, political affiliation, how their injuries occurred. So that when we're in areas that are war zones, we're sometimes treating both sides of the war. So that's one of the things that keeps us safe, is that people know that we're not there to take sides, we're not there to make judgment, we're there to treat people who need our help. The people know that if they attack the MSF group and we had to leave the area, they would have no doctors and no surgical care in that area. So they're protective of us, and that's usually the most important thing for our security, is that the local population understands what we're doing and wants us to be there.
Is there a reason that you were drawn to Doctors Without Borders?
I have to say there's two parts to it. One is the enjoyment I get out of doing it. I enjoy the chance to travel, to have new challenges, meet new people, and also a sense of giving back, that there's so much we have here, and a lot of these people, through no reasons of their own, no fault of their own, they don't have very much, and I think it's great that you give back, whether you give back with your time, whether you give back with your money, whether you give back with moral support of people.
And what advice would you give someone looking to pursue a similar path to yourself?
Usually what you need is the ability to adapt to changing situations, or situations that aren't what you expect. Having some language skills helps, because often you're working in countries where French or Spanish can be of benefit. And generally just sort of getting out and seeing the world a little bit, so that if you're put in a strange situation, you can settle into fairly quickly without being too anxious or stressed.
After your first trip, what was it like readjusting?
I think the biggest change is probably you see how much things are wasted. It's certainly in the medical point of view, that we do a lot of things that are very expensive, that don't seem to have a lot of value, and when you've just come from a setting where these things are, if not priceless, at least greatly valued, you really notice the waste. And maybe also feeling that people don't really appreciate what they have, that, you know, they complain that their shoes don't match, or, you know, they need another pair of pants and it's their 15th pair of pants, and you've come from a place where people literally have maybe 1 or 2 pairs of pants. So I think it makes you appreciative of what we have.
Thank you so much for meeting me
you're very
today.
welcome.
I appreciate it very much.
I've enjoyed talking about it, and perhaps someone who's watching the interview will think, gee, I'd like to volunteer, if not with Doctors Without Borders, with some other group, and get involved more with international projects.